Global COVID-19 infections have surged past 15 million. Cases in the US, Brazil and India make up almost half that number. And the virus has claimed more than 600,000 lives. An expert joins us live to share his thoughts. Dr. Ramanan Lakshminarayan is Director and Senior Fellow at the Center for Disease Dynamics, Economics and Policy, as well as an affiliate professor at the University of Washington. Dr. Ramanan, thank you for joining us. So more than 15 million cases worldwide. That's triple the number of severe influenza illnesses. Now, how severe do you expect this to go?
We have to remember that the 15 million cases are reported cases. And even the United States, the Centers for Disease Control estimates that their reported cases represent only a tenth of the true caseload. In India, a recent survey that was released just a couple of days ago by the government indicates that the number of reported cases is only 1/40th of the true number of infections. So the true numbers of infections are vastly greater. And that represents, both a challenge and perhaps some good news. I mean, the challenge is that a lot more people will get infected. And if we're only at a 600,000 mortality today, we still have a long way to go. But it is good news that many people seem to have asymptomatic infections and are not as affected. So when we look at the true infection fatality rates, they might be lower than what we had originally feared.
Those are perhaps encouraging numbers, but there is no sign of the virus slowing down. What more can governments do to control the spread?
To be perfectly honest, I think how governments control the virus is not a function of what they do today. It's how much they prepare their systems, going back decades. If they don't have the healthcare infrastructure, if they don't have the governance systems, and if they don't have, the societal education and discipline to make this happen, it doesn't matter if it's a poor country like India, where there has been political leadership, or a really wealthy country like the United States, which has all the resources available to it. The virus is not going to get under control. So I think it's going to take a combination of resources, but also leadership and governance to really make it happen. And you can see the wide disparity between places where the virus is under control and where it is not.
Right, so let's look at the vaccine then, because 3 potential vaccines have shown promising results in human trials. Can we then take that as a sign that we are well on the way towards a commercially available one?
Well, phase 1 and phase 2 trials, which is all that we have crossed with many of these vaccines, only indicate if the vaccine is safe in a very small population, and second, if it seems to produce the antibodies that would be helpful to take the case for that vaccine further. These trials do not indicate if the vaccine can actually protect someone from the coronavirus. That only occurs in phase 3. Till now, we don't have a vaccine that has crossed that stage. And historically, there's a lot of failure between phase 1 and 2 and phase 3. I'm not saying this is impossible. It is just to say that vaccine development is extremely challenging, and the bar is very high for this virus, for the vaccine to be safe, because we will have to literally vaccinate most people on the planet in order to protect them from these cases. So the vaccine had better be extremely safe. Otherwise, people will lose faith in vaccines as a whole. And so I think we still have a long way to go before we can really celebrate here.
Yeah, with that in mind then, is there any other progress on other COVID-19 treatments?
We haven't really had any progress on the antivirals, which is sort of the first attack, because, attacking a virus and killing it depending on its stage of development is extremely hard, not that easy. We've had some evidence that corticosteroids, which really, tamp down on this, what is called the cytokine storm. In other words, our body's immune response to the virus, which ends up causing damage to our cells. So the couple of drugs like dexamethasone, which help tamp that down, have been found to be helpful, but only if given to people who are really sick. If these are given to people who have milder forms of the disease, then it could paradoxically do more damage because it comes in the way of the body's immune system actually responding to the virus. I think we've learned a lot in terms of how to clinically manage this virus, given the 4 months of evidence and research that has come out. But I don't think it's the case that someone with COVID-19 is safe and without risk. And the risk is high enough that we want to be careful in terms of preventing the infection in the first place.
Okay, many thanks for your thoughts this evening. We've been speaking with Dr. Ramanan Laxminarayan, Director and Senior Fellow at the Center for Disease Dynamics, Economics and Policy.